The ugly truth is this: healthcare is not treated as a human right in the United States of America.
Since the world has been on shutdown and the hospital rates are increasing, many Americans struggle to pay for their medical bills. 41% of the American population are in debt due to the medical bills. The only way to address this problem is by looking at the medical system as a whole.
So in this country, our healthcare system is based on mostly a private enterprise where businesses offer healthcare services in exchange for money, and that is provided either by the patients themselves or through an agreement with an insurance company.
Compared to the other countries, Americans' population pays more for healthcare. An average American pays $1,122 out of pocket for healthcare, while other countries pay less than half of that. Even though the American citizen pay more, they aren't getting the best service. America has the lowest life expectancy rate, the highest rate of preventable deaths, and one of the lowest safety standards for childbirth.
And that idea was to simply suggest that maybe the United States of America should do what virtually every other major country on earth does and guarantee health care to all people as a human right, not a privilege.
Free health care, available health care, transportation to the health care, it uplifts mentally. It's a positive thing when people know that if I'm not feeling well, if something's wrong, I can always go, no matter my life circumstances, my financial, where I am financially. That doesn't affect me being able to see a professional to see what's going on with me.
3 years ago, Justina Juantas was in a serious car accident. This accident left her in a wheelchair for many months. While injured, she was unable to afford to go to the doctor because she didn't have health care.
I have a metal steel rod in my leg and a couple of screws, and I was not able to check out the progress or the healing of my bones or the metal in there, or the trauma, the mental trauma. Basically that kind of, I wasn't able to go and see the doctors and things like that. So,
with many people not having health care, hospitals such as Prisma Health offers programs to help people financially.
The programs. We have one program is called Prisma Health Financial Assistance Program. And if you don't have any type of health coverage, no type of income, you may qualify for our health insurance or financial assistance program. And what that is, it goes based on the number of people in your household. It goes also on the fact that you don't have any health insurance coverage, and also will look at your income. If you meet the poverty guidelines of 200% below the poverty guidelines, you may qualify.
The Affordable Care Act has lowered the price for people within the 100 and 400% of the poverty level, but these benefits do not cover everyone. The people who do not have these benefits are more likely to get plans that offer things that they do not need.
The system we have now is based off of more of money. So if you're single or if you're somebody without kids, it's harder for you to get health care because they're more worried about people with kids and how they're doing, and they don't really spread out their thought process when it comes to different people.
The research suggests that it's pricing failures, middlemen, and inappropriate medical care. The politicians primarily talk about different ways to finance the broken healthcare system. We need to talk about how to fix the broken healthcare system because people are getting crushed out there.
Chairman Roger Marshall wants to create a new healthcare plan, but this plan will not help all. His new plan will only reduce the price of healthcare instead of making it free and available for everyone.
One of the major objectives is to drive the cost of healthcare down. So I mentioned number one, you're going to be able to use pre-tax dollars if you're in that self-employed market. So that's going to be about a 30% savings for everybody. And then when we promote competition and choices, that's going to drive it down as well. We promote innovation, we promote transparency, and we promote patients becoming consumers again. So all of those are going to drive the cost of healthcare down.
Joe Biden discusses how Trump tries to get rid of our healthcare.
On November 10th, the United States Supreme Court will hear the Trump administration make the case that the Affordable Care Act should be struck down in its entirety. I know everybody thinks they know, but I just want to remind you, 10 million of you have already lost your health insurance because your employers health insurance, they've gone out of business. 10 million Americans already without health insurance.
But Joe Biden has a new plan to help the people.
An independent analysis found that my plan will slash the cost of prescription drugs by 60%. Not a liberal think tank. Serious folks looking at this. Here's the bottom line. My plan lowers healthcare costs and gets universal coverage quickly. At a time when Michigan families desperately are going to need that relief, and they need it now.
A big change that we would like to see in 2021 is a universal healthcare system. This new healthcare system will allow us to have free healthcare paid for by the taxpayers.